Welcome to this edition of Ask a Nurse. I'm going to talk about cancer today and the grades and stages of cancer because cancer has been in the news a lot. King Charles has cancer, Kate Middleton has cancer, Shannon Doherty has stage 4 cancer. So let's talk about cancer and how it is graded and staged. Do you have a medical concern or perhaps a question or a situation that you think a retired nurse could help you with? Email me to the email you see on your screen. If you want to be anonymous, please let me know in the email and I'll see what I can do. Good morning, you beautiful souls. I was asked to do this video quite a while back because there was some shenanigans going on YouTube. Oftentimes, guys, YouTubers claim they have cancer just to cause drama, just to, e-bag or whatever they're going to do. If you have a specific question about a specific YouTuber, if perhaps you have a channel and would like to invite me up on your panel to talk about the individual's cancer, I'll do that. But I would like to invite the YouTubers that say they have cancer, if you could please post your medical papers or, allow me to read those medical papers for you, because I do know that the medical papers, when it comes to long, drawn out doctor's notes, they're kind of difficult to read. So, two things. If you think that there's YouTube shenanigans going on, invite me up on your panel and I'll tell you what I know. If you yourself have concerns, or perhaps you yourself have a diagnosis, send me your medical papers and I'll be more than happy to read them to you. Perhaps in a Zoom conference if you want to do it privately, or on your own live if you're experiencing a cancer diagnosis. I would be more than happy to do that for you. But cancer is usually diagnosed, we look at two things. We look at grades and we look at stages. Now, what does that mean? Well, a grade describes how abnormal the cancer cell looks compared to a healthy cell. The lower the grade, the better the outlook. Usually there are 4 grades. Grades refer to how the cell looks under a microscope, okay? So some labs, I'm saying there's 4 grades, all right? Because most labs use 4 grades. But some labs use 0 grade to represent the normal cell, and some labs go all the way up to 5. But universally, 4 grades is accepted, okay? So the higher the grade, the more abnormal the cell looks, and the faster the cancer is likely to spread, all right? That's what we talk about when that's what we're talking about when we talk about grades. And the more undifferentiated the cell looks, the more likely it is to spread. And the more differentiated it is, the more likely the medication can work on the cancer cell. I'm going to show you pictures in the next slide. All right, so that's what we mean by grades. Now, when we talk about stages, stages refers to the extent of the cancer cell. The higher the stage, not the grade, I put grade here on the slide, but the higher the stage, the more serious the cancer has spread. And universally, there are 4 stages of cancer. So like I said, to the YouTubers that are suffering from cancer, if you're getting haters, I invite you to private message me your medical papers, and we can discuss it in a Zoom meeting if you'd like to do it privately, or we can do it on your panel, whichever way you would like to do it. And I also do the same with the haters. Or, I don't want to call you haters, but you know what I'm saying. If you think the YouTuber is making up a story, um, you know, I will invite you to ask me questions in the email or go up on your panel, right? I say haters loosely because if you don't agree with somebody on YouTube, you're a hater. But, perhaps you're not really being a hater. Perhaps you have some serious questions. And cancer is serious, okay? So comment below or send me an email, whatever you'd like to do, and let's see what I can do for you. Okay, now I want to show you some some grades. Grade 1, grade 2, grade 3, grade 4. Let's talk about that in the next slide, shall we? Alright, remember I said that a grade is the way that the tumor or the cell, right, the cancer cell, looks under a microscope. So we can see with grade 1 how we can really see that it's well differentiated. We see the individual cells in the tumor in this case. And the more differentiated it is, the more it looks individual. You see how it looks individual? The more individual it looks, the more the medication can attack those individual cells without, hurting the rest of the body. You know what I'm saying? So the more differentiated it is, that's really great. The more differentiated it is, the more likely it is that it can be eradicated with medication. You see? So when we look at grade 2, that's moderately differentiated. You see, it's starting to get jumbled up, but it still looks round. You can still make out the individual cells of the tumor. You see? Grade 3, it's poorly differentiated. Now, it's starting to look all mixed up, right? Well, when it starts to look mixed up like that, the medication is going to be mixed up, right? We can't target the individual cells like we can with grade 1. With grade 3, we have to start giving you chemo because it's starting to get all mixed up, And then with grade 4, now it's totally mixed up. And in grade 4, you can see where it's even starting to grow. The cancer's starting to even grow more. It's starting to metastasize. Well, it starts to metastasize in grade 3. But grade 4, it has metastasized to the distal parts of your body. And the more the cancer spreads to the outer part of your body, that's what distal means. It means outer. The more it spreads to the distal parts of your body, the more likely it is that it's non-curable. We're not going to be able to get it all. It depends, though, guys. It really depends. It depends on the type of cancer, because, breast cancer is different from lung cancer. Prostate cancer is different from kidney cancer. Specific cancers are more serious than other cancers. So the grade is just the way the cell looks under a microscope. And that's what's known as a biopsy. When they take a piece of the tumor cell, wherever it may be, skin, kidney, whatever, they cut it and put it under a microscope. When they cut it and put it under a microscope, it's called a biopsy. Okay, guys, I'm trying to talk about this in simple terms. It's actually quite difficult because I do tutor this for the state boards. But let's talk about stages now, okay, guys? This is why I want to help you with your medical papers, because you're going to see initials like T and N and M. And what does that stand for? Well, T stands for tumor, and usually right next to the T they have the size of your tumor. So, like 2 centimeters, there is 2.5 centimeters in an inch, right? So, for example, like your tumor might be 2 centimeters. Um, the lymph nodes, N, if you see an N on your paper, that stands for lymph nodes. Now, the lymph nodes are all over in our body. It's all over. Mostly on the left side, under the left axilla, okay? Under your left underarm here. And the lymph nodes help drain things, help drain the fluid in our body. The lymphatic system is in charge of like infection control, right? You get sick, you have swollen glands. That's part of your lymph nodes. So when the cancer involves your lymph nodes, now you're definitely immunocompromised. You see, because the lymph nodes is in charge of helping our body to stay strong. The lymph nodes are in charge of our immune system. Okay, so you might see an N on your paper, and an M stands for metastasis. Now that's a big word for spreading, where your cancer cell has spread. Metastasis. So T is tumor, N is lymph nodes, and M is spreading. Okay, so in stage 1 cancer, it's usually a small tumor. I wouldn't say that 2 centimeters is too small, but I'm just using that as an example, okay? So in stage 1, the tumor is small and hasn't spread. In stage 2, the cancer tumor has grown more deeply into the nearby tissue. So in stage 1, it might just be sitting on top of your skin, let's say, your skin cell. But in stage 2, it grows deeper into that cell, but it doesn't necessarily spread at this point. It's just getting deeper into the cell. It's like embedding itself, you know? That's a good word, embedding. So whether it has lymph nodes involved or whether it spreads, we got to be careful because it's starting, right? So question mark, question mark. Stage 3, the cancer has definitely spread to the lymph nodes, which is a bad thing because the lymph nodes are in charge of our immune system, the lymphatic system, you see. It drains, the bad fluid out of our body. So what area of the lymph nodes? Like I said, lymph nodes are all over your body, and mostly it starts under your left underarm, but you have lymph nodes all throughout your body. So under N, it might say where it's spread. What part of the lymph nodes are affected, and under M, it might say where the cancer has spread. This is where your medical papers start to get more difficult. This is why I want to help you read your medical papers if you care to have me help you, because it is difficult, ladies and gentlemen. And then stage 4 cancer means that it has spread throughout the body. I'm sorry, I'm looking at something on the screen. It's spread throughout the body, and what area of the lymph nodes are involved, and the more it spreads, the poorer the diagnosis, right? The more it spreads to the outer part of your body, the poorer the diagnosis. Okay? So that's basically the grades and stages of cancer in a nutshell. Now, I did get a couple of questions, so in closing, let's go over those questions. So now, here's a couple of questions. Now, I did see a YouTuber that said that the doctor diagnosed her with cancer before she had any tests done. So The question is, can cancer be detected without a biopsy? And the answer is yes. Especially trained dogs can pick up the scent of cancer cells because of their superior smell to humans. So while they can smell the cancer, your doctor cannot. Okay? So while imaging and blood tests can show suspicion, a biopsy is the only way to diagnose a cancer, right? So, all joking aside, can cancer be detected without a biopsy? No. Your doctor cannot say, oh, the doctor cannot just look at you and say, oh, I think you have cancer. No, it doesn't work that way, okay? The question number 2 was a pretty good question. I like this question. What type of cancer is most curable? And there's tons of cancer, right, guys? Because the body is a massive, intricate. It's just beautiful, right? But because it's so intricate, a lot can go wrong with it. So there's lots of cancers, but the 7 most curable cancers are breast cancer, prostate cancer, testicular cancer, thyroid cancer, melanoma cancer, and Hodgkin's lymphoma. Now, to the YouTuber who said that the doctor looked at her and said she had cancer, I'm just going to throw it out there, ladies and gentlemen. Nasal cancer is pretty curable unless it involves other areas of the surrounding tissue. Your nasal passages are connected to your sinuses, are connected to your ear, are connected to your eye. Now, there is a YouTuber who I actually have on the prayer list in church because she had nasal cancer while she was pregnant. So she had the baby, and she's very much suffering with her nasal cancer because it's affecting her sinuses, it's affecting her eyes. She lost one of her eyes. So to the YouTuber that's making light of your nasal cancer you supposedly have, you should really, examine what you're doing. And, you should really let me help you read the papers and, set the record straight for you. Because there is someone on YouTube that's suffering terribly from nasal cancer. And God bless you, but I don't see any of that with you, So I don't know why I was asked this question, but I was asked this question. And so that's my opinion, and that's my answer. Okay, 2 more questions. When will I lose my hair? Now, I've seen people on YouTube shave their hair. That is not the same as losing your hair. And you don't need to shave your hair for any reason unless, your hair will naturally fall out. If it's going to fall out. Not all chemotherapy makes your hair fall out. So there's no reason to shave your hair. Okay? So hair loss is due to chemotherapy. Like I said, not all chemotherapy makes you lose your hair. You will, this initially happens 2 to 3 weeks after starting the treatment, which, now, this is a very good question. What is the difference between chemo and radiation? Okay, chemo is medication and delivers drugs to the entire body. Okay, remember the well-differentiated grade 1 that I showed you. Okay? Chemotherapy is not used for grade 1 and 2. It's usually grades 3 and 4, right? where your cells become undifferentiated. We can't tell the difference between the cells. So the chemotherapy, we don't know what's a good cell. We don't know what's a bad cell. So we give you chemo. Now with chemo, it also kills the bad cells and the good cells, which is your hair growth cells, for example. That's why you lose your hair, because chemotherapy does not differentiate between good cells and bad cells. It kills mostly the bad cells, but it gets good cells with it. That's why you lose your hair. Now, radiation is different. Radiation therapy can target the specific cells, the specific cancerous cells. Now, radiation can be used and is most successful with the well differentiated cells, the individual cells, right? Because it can target those cells. It can say, oh, that looks like a cancer cell, right? And it zaps it. Radiation is a high dose of energy to a specific area. So if you have grades 1 and 2, you're probably going to get radiation. If you have 3, you're going to start to get chemo. If you have 4, you're going to get radiation and chemo. Listen, I'm just using this as an example. Doctors do whatever they want to do. You might start out with radiation and chemo all together. I'm just telling you the difference between chemo and radiation. Chemo is a medication that delivers drugs to the entire body. Radiation is a high dose of energy that delivers doses of energy to specific cells. Whew. That was fun. Okay, so there's your presentation on grades and stages of cancer. If you have any questions, if you have any fusses, if I can lay to rest anything, if I can help you in any way, please let me know in the email, and I'll see you guys in the next video.